Excellent. Hey, everyone, thank you for joining the webinar, and thank you for your patience as we work through technical difficulties. As you can see, if your screen looks like mine, we still have technical difficulties, you'd think, but no. Thank you, Rena, for managing all of this work. Greetings and welcome back. There I am in the photo this time. Thank you for adding some notes. You'll notice I do not want to talk about snow because we are still looking at a lot of snow here in Minnesota. But I do want to talk about the Minnesota Lynx because the WNBA season is about to start, and we're very enthusiastic fans here because we are winners. And that was my women's sports promotion for this webinar. All right, next slide. Okay, most of you know this is the fourth in a series. We've been through 3 already. A very quick bottom line session that was more of a rant. The second one was Framing 101 that took us through sort of the basic framing principles. We talked about elephants, we talked about values, and we searched for these things and analyzed certain media products. And then last week, 2 weeks ago, we talked about adolescence and sex. That was a very stimulating conversation. And in that session, we talked about a little formula on how you combat when people say awful things about adolescents or continue to perpetuate bad stereotypes about young people. And this week, next slide. Ooh, how about again? I'll just let that stand slide. Oh, go back one for me, would you? I'll just let that big red box stand. So you saw that the heading on this was sort of a rambling list of all the words that we're using to talk about the basic issues that define the disparities that we see in adolescent health outcomes. And so you know where this is going to go. And I just want to give a heads up about it, that not only are we treading in this territory, but it's going to require a lot of self-reflection on our role in this larger process because, at least for me, I'm a white woman and I work in the university system, which is its own little center of these activities, and I suspect that many of you work in systems as well. So just a little heads up so that you can be aware that that's where we're going. And please, I want this to be a place where you can push back on me and listen with open ears, but if it's too much, please do not hesitate to bail. All right, next slide. And I bring that up, and I'm showing you this old intro slide from my presentations on these topics because the thing we got to recognize if we're going to do work around this topic in public health is that we are going to make mistakes, step in it, and we need to be ready for that to happen and be okay with it because that's the only way we're going to learn and grow and figure stuff out. The slide that you see here for when I was doing this for the Pennsylvania Department of Health, man, that was like 10 years ago, right? And this was my intro slide. It was like a hero photograph, right? I would start by saying this photograph changes the way the way people look at young people. And then the discussion would be, well, why is that? And it's because, look at these young people are engaged in community. They're doing things that show how much they share adult values or community values. And by representing young people this way, we can begin to shift how the public looks at young people. And it was a few years later when somebody pointed out that that photo was also sending a different message that I did not intend to send and did not want to send and didn't know I was sending. And so I replaced the photo with this one. Does anybody want to jump in? And Rena, if you could toggle back and forth between these two photographs and tell me why. What's the difference? And what message am I sending with that first one versus the second one? And I'm going to stand by. I see other people struggling with audio. And yeah, it sounds like the dialing in is not going. And yes, folks have already jumped in immediately to notice that in the first photograph, the white woman is leading the whole session. And in the second session, a woman of color is leading the entire session. And so what's up with that? right? And I, at the time, I'm all about justice and equity and all that sort of stuff, did not even see it. And that right there is my privilege in thinking about these things. And if I want to back off and take a rational approach, do you know what I mean? I'm like, oh, photograph one, it was better framed, and I like the way the young people were put around there. And I'm going through this whole exercise to point out to you that every decision you make is going to come with these messages that you may or may not be aware of. And we're kind of dumping into that framing area here. But how do we then be aware and be willing to address it? And then how do you respond, right? When somebody walks up to you and is like, by the way, you're all talking about framing young people. Did you realize what you just did to people of color with this? Because this is a traditional trope, right? Something that happens all the time. So that's the story. Just wanted to set it up and to tell you, too, that I am going to probably make more mistakes as well. And if you could click one more time, Rena. Make sure I slammed my entire contact list information here. No, maybe not. You know where I live. Email me, text me, or put something in the comment box to tell me what I am doing wrong or right or whatever. Please, please. That's the only way I can get better. All right. Most of you heard this before. My background is in advertising. This very unsexy ad that I got to work on was actually the pinnacle of my career. I know you're laughing. And it was the pinnacle of my career because I worked on Hewlett-Packard, and what Hewlett-Packard would do is every single division, every single product division would have their own ad campaign, their own budgets, their own ad agencies to some degree, blah, blah, blah. And although they had a standard for how that logo got placed, there was no consistency in their advertising overall. And because when I was leaving, old person, everything was about networking, we finally, after years of effort, convinced them to put some money together to have a unified campaign and show all of their products together. And this was one of the ads. We had a whole series. I'm bringing this ad up because when we get into the implications of talking about equity and disparities, we are going to land squarely in the social determinants of health. And when you start thinking about your role in the addressing social determinants of health or communicating about social determinants of health, you, depending on your job, might find yourself sidestepping or stepping away from the core area that is your focus, right? So if you're a teen pregnancy prevention person and you start to believe and recognize that if you don't address the social determinants of health, right, by increasing access or addressing racist behaviors by clinicians, are you still doing teen pregnancy? And if you might feel that in your heart through your funders or your bosses, right, that's what you're getting into, and that was part of the problem with Hewlett-Packard, right? I didn't want to give up my real estate. I didn't want to give up my space for a big, beautiful picture of a LaserJet printer. And I know it sounds ridiculous, and I'm not trying to make light of our larger challenge, but I want you to be thinking about what you gain and what you lose by moving into these sort of discussions and these frames. Okay, next slide, please. Since I did my women's sports promotion on the front slide, I thought I would go back to Gisela Kanapka a little bit. Folks, this is a standard where I work and what I do slide. You can see all the logos down there smashed in the bottom. Just briefly, since they are paying for this, the two big grants that I get to work on. One is the Prevention Research Center. It's funded by the Centers for Disease Control. And the CDC funds a bunch of universities across the country who are doing exactly that, prevention research. As you might imagine, we're entirely focused on young people as our population, and we've been focused on teen pregnancy and sexual health and reframed ourselves around healthy youth development, looking at how do we support the development of young people as a way to address outcomes. The other logos there, the State Adolescent Health Resource Center and the Adolescent and Young Adult Health National Resource Center, are funded by MCHB with the intention of supporting state adolescent health staff to address National Performance Measure 10, which is increasing the rates of well visits for young people. And that beautiful old gal there on the photo is Gisela Kanapka. And we at the University of Minnesota, many of us consider ourselves part of the Kanapka Institute who follow in her footsteps. And just for a change of pace, but also because I feel like it gets back to our core issue, here's a little quote from a flyer I did, what would Gisa do? because Gisela Knapper not only was like really champion of adolescence, she was also really hardcore about what our responsibility as adults or old people that work with young people is. And so I really like her finger pointing tone, and I mean that in the positive way. Okay, next slide. So what happens when you leave an ad agency and join the public health world? You get to do webinars like this one, and you get to make cool products like these. And this is stuff that I've worked on translating either epidemiological or student survey data or research data into communications that are intended for general or non-technical audiences. You can see the annual checkup for the well visit. You can see climate insights around safety, where some of the researchers I work with were trying to gauge how much of an impact climate has on outcomes. The chlamydia report is a collaboration between the Minnesota Department of Health and the community to address chlamydia prevention. And the two kind of cool infographics are again from university researchers who actually for the first time were able to quantify what percentage of the student population in Minnesota identified as transgender or gender nonconforming. I'm really excited about the work that they're doing because they are also, through mixed methods research, figuring out what is impacting from an external factor perspective mental health and other outcomes for transgender and gender nonconforming young people. And it's fascinating, right, you all? It's like like communities that have higher GSAs and PFLAG organizations turn out to be protective, but for girls, maybe not boys. At any rate, this is evolving, and hopefully you'll see more soon. Next slide, please. Okay, so this is the long laundry list of my key points. And by today, we will have covered every single one of them. But the stuff in red is the stuff that we are going to be emphasizing today. And the really big new one here, of course, is illuminate the social determinants of health. Interestingly, for somebody who's trying to prepare these trainings and done it for a long time, so much of this stuff overlaps, but I've tried to keep it really fresh for folks who have been on before. Next slide. And this is by way of saying that we are jumping right into the soup. I am not going to talk about framing concepts or elephants or mental shortcuts except only in reference. And I need to go back to the very first session that we had, which is to say, just in short, and this might blow your mind if you were not on it before, that when we, in public health or in places of credibility and authority, present health disparities data that reflects race on the axis, we are both illuminating the problem and reinforcing existing public beliefs about the causes of those problems. And I'm going to leave it to your imagination on what the reflexive response is to what is the problem. Oh, next slide, please. Okay, so after this webinar is over, you're going to have a chance to download a bunch of stuff. And you're going to be able to download that fancy colorful thing, which is really just a recap of the key points I'm making. Fix-It V2 is the thing on the right, where it's just a little teeny activity for applying what you've heard today. Social determinants and talking inequality are two of the readings that most closely align with the content today, and they will come up several times. And then, of course, the huge list of references, everything that I've read that kind of gets to this topic. And the images that you see are things that you're going to hear about and see in the presentation. All right, next slide, please. Yeah, this is all based on research. It is not necessarily the kind of research that we in public health are known for or comfortable with. It's all qualitative. Sometimes there's content analysis, but generally it is qualitative work, focus groups, and they are not talking to people to find out what they believe. They're trying to talk to people to find out what they think that leads to what else they think that leads to what they believe. You need to know, and this will come up a little bit later, that a lot of this research skews towards mainstream / middle class public audiences. And let's draw a box around who they're probably talking about here, right? There have been instances where they've very specifically gone in and talked to different cultural communities, but in general, keep your eye aware of who they are surveying when you look at the research yourself. Next slide. The single thing, if you could walk away from this webinar having in your brain, is that when we are talking about health disparities, and I would push that further and will, to how we do what we do, is to think about the role of the individual as after you think about the role of the environment and systems and how those things impact health outcomes. Next slide. One of the framing challenges we face in this country is that Americans prize as their #1 value, some of the framers call it the first language of Americans, is individualism. And you know this, right? Bootstraps, work hard and you can get anywhere, right? Self-made American, all of that sort of stuff. So the first thing that anyone thinks when confronted with an accomplishment or a failure is what did that individual do or not do to create that situation. And it is not to say that Americans don't believe in interconnectedness, right? I mean, that is a steadfast thing about our history and our, daily lives, right? You can think about everyone coming together to raise a barn or going to a protest or a baseball game or a parade, right? Picnics, all that sort of stuff, state fairs. There is interconnectedness. That said, that's interesting. That is the second, third, eighth thing to come up. The first thing is always individualism. Next slide, please. The second thing that's problematic is another deal about how our brain works, right? We've talked before about mental shortcuts, right? The way your brain takes in content, it links it to what it already knows so it can move on quickly to the next thing. Here's another element of that I had no idea about. It's called the fundamental attribution error. And this is research that shows that our brains have a tendency to process content or information that attribute blame to others when it's others, but attribute blame to the external environment when it's about us. For example, they did a research study. They showed young people playing basketball in a gymnasium videotape to viewers. And the first videotape they played, the kids were terrible. The young people couldn't make baskets, their passes were going all over. The second video, they were great. And the researchers said, why do you think these are different? And as we've just been discussing, the answers were, oh, well, those kids in the second video that were really good, they practiced really hard and they got really good skills and they are talented, and those first kids, not so much. And then the thing was, the young people that were bad were playing in an unlit gymnasium, and people don't notice that. If you're walking on the street and you trip at a crack in the sidewalk, my reaction is, oh, wait a minute, why is this crack here? This is very unsafe and somebody ought to fix this. But if my colleague Rena did it, I would probably be likely to say, oh, wow, why did you pick those shoes? Or, Rena's so clumsy. Do you see where I'm going here? And can you see how this is going to be applied to different communities differently? Right? And this is something that's happening in our brains. All right, next slide. The thing we have to contend with over and over again is that when we're talking about our public health issues or the health of young people or the nature of community, folks are not necessarily considering that your likelihood of engaging with nature or getting physical activity outdoors is going to be different if your park looks like the one on the left versus the one on the right. Next slide. that your experience of community and school is going to be different if you leave the house on the left every morning and get there versus the apartment building on the right. You know these things. The rest of the world does not think about them. Next slide. Even as broadly as talking about health overall, right? When we bring up and talk about health issues, whether it's in the newspaper or our own communications materials or even around the dinner table, what is the first reaction when you say, let's get healthy? The first reaction is, well, sure, anybody can be healthy. What you need to do is put on those cool yoga pants and that jog bra and hit the trails, because anybody can do that. All you need to do is get out there and do it. And there are truths there for sure. I mean, I certainly own, to a large extent, my obesity personally. That said, I am not going to be wearing those yoga pants and jog bra anytime soon, A. B, my town is covered with snow right now. C, right? I don't have the needs to do that, right? Like, I could give you a whole litany of things, but what I want you to pay attention here to is the focus on the individual and what they choose and how they behave versus how the environment or systems and structures around them impact those choices. Next slide, please. Right? Where do these things come into the picture when we talk about these issues? And I know that on some level, from a public health perspective, these are considered, distal or too far removed from the core issue and problem. But I also know what we're getting at is that addressing these things is going to improve a whole host of adolescent health problems, as well as community issues, and that these factors are something that have gone unaddressed for far, far too long. I'm thinking about, and can you connect these sort of external factors to your own health issues, right? Like, even if you're not working with school populations, can you connect, school experiences to, I don't know, violence involvement? Can you connect food systems to the obesity epidemic? Can you connect transportation to, physical activity, right? How about funding allocation? How about the processes behind funding allocations? You see where I'm trying to go? And this is the stuff that we need to make visible and bring into the public conversation. Okay, next slide, please. I know you're wondering. Next slide, please. Ta-da. You see the little red and green boxes? That's going to be more clear when you look at your handout. I tend to put things that are problematic mental shortcuts or elephant-like shortcuts in red, and the recommended approaches in green, right? So here it is. Reduce our focus on individual behaviors and data, increase our focus on structural or systemic data. Next slide. One little thing here, and we're not diving into this super deeply, right? But you know how before we were talking about goals and people having different goals and are they shared, et cetera, right? Here's another spin on that. In the fundraising community, the belief or the knowledge, I shouldn't diminish it, the knowledge is that you need to really make the stories individual, and you need to really pull on heartstrings, and you need to talk about personal transformation. So the challenge is, can you do that and still address systems, right? Because if you put up a story like this, which ostensibly is a great story, right? Twee was born in a refugee camp, and she worked hard, and she got the scholarship. What's the message that's coming through here? Like, is this reinforcing some of those beliefs we were just talking about? And I know that may not be your goal, but really what we're doing is exceptionalizing Twee. And we're also saying, see, individuals, she did it, Twee did it, why can't any Hmong kid do it, right? So that's the solution. Next slide. Oh, one more, sorry. Animation, ridiculous. There we go. You can still have Twee in the story. You can still give a lot of real estate to her and her awesomeness, but can you frame it or link it back into the larger environment or the context, right? And maybe this one takes it too far. I get a little overboard sometimes, right? But see where the emphasis has shifted to how the community or how the systems are playing a part in Twee's success. Is this annoying? I mean, it's weird, isn't it? Because, like, I mean, you don't know Twee, but I know Twee, right? And I kind of don't want to give her credit to Ramsey County. At the same time, I know that that's essential, right? That if the community isn't thinking about the role that Ramsey County plays, all that stuff is not going to exist. So here's a tension. I know I've shared many of them, and here is yet another one. All right, next slide. So we're talking about emphasizing individuals versus environment. And oh my goodness, so I'm looking at this really, really small, but here's another way to do it, right? We talked last time about how the Teen-wise sexual health report flipped and put their recommendations or solutions at the front because we know that crisis data isn't compelling, but solutions or recommendations data does get people kind of engaged and thinking about what they can do. And they embedded these systems messages into their recommendations, right? Look at bullet point number 3, the systems we rely on to educate young people do not provide the supports, blah, 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 blah. Look at the last one. We will not make further progress improving adolescent sexual health without directly addressing social factors like education, income, housing, neighborhoods, blah, blah, blah. Now, this came about partly because I was being my hard whatever self, and they were like, hey, let's work on a sexual health report. And I'm like, yeah, let's not, because that data, especially the disparities data, is not doing anybody any favors. And they were like, yeah, well, that's our job. And so we agreed to put these solutions up front, but also believe in as much about the external factors or ecological model as we possibly could. And they did a great job of trying to put this stuff in here. More challenges on that front. Next one. We go to our friends at the CDC version. Again, it's harder for them to do the environmental focus over the individual one because of, again, of the nature of where they sit, et cetera, et cetera. And I'm not trying to let them off the hook. I'm just pointing out that their goals and audiences might be different, but it's still a little bit in here, and there's opportunities, right? Like the fact that social determinants and eliminating disparities in teen pregnancies, even in the sidebar, heck man, that's progress, right? As we talked about last time, that little icon that talks about healthy teens and healthy communities, that starts to get there. I wished in that sentence there that there was an opportunity to be even stronger, like, although reasons for the declines are not totally clear, evidence suggests that these declines are due more to teens abstaining from sexual activity and more teens who are sexually active using birth control than in previous years. That would have been a great spot to talk about the role community or structures play in creating access to birth control. Next slide. And we see a little bit more of it. Anyone have better resources than the CDC for teen pregnancy or STIs? Yeah, Kat, good question. Oregon. And I think that, and even the CDC, like if you go into different sections, there's better stuff. You know, I'm picking out stuff that makes my story, but other folks jump in here and give Kat some suggestions on places that you know where sexual health is considered in the larger social determinants of health context. Oh gosh, who are those women in New Mexico who have the awesome reframe around this? Oh man, I'm gonna have to think about it. Does anyone else know what I'm talking about? And then who is the researcher that does all the work on weathering? That's another one to take a look at. But at any rate, I'm gonna move on. Yeah, okay, Kristen's jumping in. Excellent, thank you. Okay, so this is the very last paragraph on the CDC's website. And here we go. We got some more of this stuff coming in here. In addition to evidence-based prevention programs, teens need access to youth-friendly contraception. Bam. So then we got that one in there. That's good. And there's a connection here, but it doesn't get to the access issues. It would be cool if they had a call-out box that talked about access and got at structural work. And then efforts at the community level that address social and economic factors associated with teen pregnancy also play a critical role. See, boom, nice. That's a really strong statement. I wish it wasn't buried in a text paragraph. I wish there were cool data points that illuminated that, and I wish it was much higher up and closer to that chart. But here are all the pieces, right? And like so many of the things that we're talking about, when I get extreme, I'm like, no health disparities data, it's evil. And then at the sort of mellower end, it's like, yeah, let's get those points in there so that it's part of the story, and let's give them a place of prominence, right? So I'm not saying rewrite your entire website. I'm saying let's move some stuff around. Let's put some asterisks or color bars or something. Okay, next slide, please. All right, more examples. Lots and lots of examples. Next slide, please. Oh, okay, re-click again. I think I got more in here. Okay, here's another way to get at it. Does that little visual with individual relationships, community, institutional, societal look familiar? I have this, ever since I worked on this project and was digging deep into this disparities, communications, framing issues, the ecological model is my best friend. I'm assuming everybody knows what that is. If you don't, type in there and other folks will jump in. Fancy way of talking about the fact that it's not just the individual, right? That family and people and structures and environments and systems and culture and policies all have a role, have an impact. And so, honestly, I try to put the ecological model in every single thing I do. And I try to emphasize the collective role or responsibility as well as the ecological model. And here again is the kind of stuff that I'm looking for us to do. We got the traditional risk and protective factors list there, and I'm not seeing mine really well because I'm having technical issues myself. But what I did was intentionally pick out risk and protective factors that were from the outer rings of the ecological model. And my researchers were not particularly thrilled with this, reframe reframe things that look individual into their external modifiers, right? Like youth who receive free and reduced lunch, can you turn that into youth unsupported by our economic system? Or, right, communities that capitalism leaves behind, or you see where I'm going, and those are not the best ways. I'm sorry, I'm losing some words right now, but that's what I try to do. And if you're doing this sort of work as well, right, maybe you're like, okay, so yeah, that's not in the YRBS. Is there a way to include your own risk and protective factors, but include some, again, call outs or higher level work that gets at the externals? Okay, next slide. So is there clear, compelling evidence of the impacts of these external factors, social determinants, one by one on every single health issue and every health topic in every population? And does anybody have that at hand? Yeah, not so much, right? At least not in the circles that I've been working in. But one of the sources that I found when I was doing this chlamydia prevention project was this work from the Wisconsin Population Health Institute. And you're going to see variations on this many, many, many times, right? And what they did was try to quantify what areas contributed to these health outcomes. And their point was, we do a lot on clinical care, but we don't do anything much at all, right, around physical environment, support for health behaviors, which they categorize kind of as public health, still not super strong. And social and economic factors, boy, 40% contributes to that, and what are we doing about that? You see what I mean? So the intention of this infographic was to show how many things come together to influence these health outcomes, which is brilliant. I mean, that's exactly the message that I think we need to be putting out into the universe more and more and more and more. Is this as hard-hitting as it could be? I don't know. I don't know. And furthermore, do I have the data? Like, could you break this out for adolescent sexual health or some of our other challenging adolescent health issues, right? I mean, what about violence involvement? Would it be different? Could you even quantify that? Again, I don't know, and I'm not a party to these kind of conversations, and that is a big old bummer. Excuse me, bad language. Bummer. Okay, next slide, please. This is another variation on the one you just saw. And this one is cool because not only is it showing, and the data is different on this one, so please don't ask me details. This one contrasts what contributes to health versus our investment in health. Wow, right? This visual is really compelling to me. Next one. This is another one that's really interesting to me. Now, this is an example of how charts lie because when you look at the portions on these pyramids, they're not right. So data friends, I'm sure you're like, what? But check this one out. And I'm thinking back to the slides about obesity, right? Federal nutrition recommendations next to what we subsidize as a country. Wow, right? Boy, and you could just go like crazy with this, couldn't you? Couldn't you be like, you could put in ecological concerns like distance travel to get some of these sort of things. You could do this next to like availability in certain neighborhoods, right? And that's where a lot of those food people are going. It's fascinating. But this is really strong to me. I wonder, is there a sexual health version of this, I wonder? Maybe it would be something like, and I'm open for ideas, maybe it would be something like what youth receive, you know, positive, healthy sexual health messages, you know, from these sources versus, you know, media sources or something. I don't know. Okay, anyway, just rambling now. Next slide, please. Oh, this is another really, really good one, right? And I got to give it to the food people. I mean, I guess it may be easier for them. I don't know. But check out how this is mapping the availability of these food items. And not only is it the availability, but it's like the distance to get to them, right? Because I'm sure some of you are thinking, yeah, well, you know, you bring up these environmental factors. People like just say, well, just go to the store or just walk to the store. And this really takes it further down. Love it. I think the inclusion of the EBT and WIC gets a little bit at the systems perspective here, as well as the ecological or environmental factors involved. Next one. Am I doing on time? Oh, I have lots more. I'm going to have to keep going. Ooh, but housing, right? Man, there was something that just came out about the impact of housing on every single health issue, but I thought that this one was good as well, right? Sexual violence linked to housing. I would love to live in a world where all of our adolescent health topics had fact sheets like this across all the environmental or ecological impacts that exist. Housing in teen pregnancy, the unemployment in teen pregnancy, right? Can you imagine? Okay, just fantasizing. Next one, please. All right. Where's the data? Where is the data? Anybody? What is there a data source that will show me experiences of racism? Ooh, I love Megan's point, right? That what doesn't support it. And something like juice, right, that might be included in something is evil. I love it. Thank you, Megan. More comments, please. Anybody who's got one. But here's my thing. Has anybody given me a national data set that includes experiences of racism? Bueller, no. Okay, BRFS does. Did I say that right? BRFSS does. Yeah, that's the only one I know. And adolescents, yeah, not really included. But again, is that, yeah, shocking? Yeah. So when I started doing this work on a chlamydia project and I read all this disparities data, I'm like, I've got to find data that shows, that demonstrates the impact of structural bias, racism, systemic, or whatever. I got to find the data. And I struggled. It is easier now, and some of our friends are doing work that's going to make it easier still. But for me, this is the central problem. And I'm going to sit here and recommend all day long that you include data points and make those fact sheets, and I know very well that finding the data to do it is nearly impossible. Even my own researchers are like, yeah, well, I can't get it from the data set, so I'm going to talk about mixed methods research now, which I didn't understand the implication of that. The implication is it's never going to be generalizable, right? It's never going to be like national blah, blah, blah. So does that work for us in public health? I don't think so. Or maybe it does. Ooh, and Samantha's got a reference back to the food, environment, and equity. Food industry related to obesity. Role of taste engineering frame. Ooh, cool, thank you. Oh, I love these resources. Okay, so two things to look at, you all. Our friends at AmChip did that life course project, and in that, they pulled out, what were they called? They're called, I don't know, factors, right, that they saw influencing health across the life course. And in there, that's where I finally found BRFS measure of experiences of racism, but they've got a bunch of other stuff in there, right? And because they don't come from our standard data sources, they will show you how to find the data and calculate it, which is totally awesome. Now, it's not all the social determinants work, right, because it's life course, but there's enough in there to get us busy and get us started. And I saw a bunch of states do that kind of work, which was very invigorating and exciting because they were into it, right? Really wanted to make that sort of stuff happen. The other one is this Robert Wood Johnson Foundation, Measuring What Works to Achieve Health Equity. Now, this is the thing where that goes through and tells about all the different kinds of data that exist that could be used and useful. Some of it is fiction, though, and a lot of it is like indexes, and I don't know how y'all feel about indexes. So these are my questions. I'm just going to let you chew on this. I know you came here for communications, but in our field, not having the data behind it is super problematic. Also, obviously, making the case to policymakers or some policymakers. Okay, moving on. Here's one of the examples from the work that this is from, who did this one? Louisiana. They took one of the life course indicators, that was the word I was looking for, called concentrated disadvantage. And they used that to show and talk about the impact on, I think this was birth outcomes. Here are the factors on the right that come together to make the concentrated disadvantage index. And if anyone's having a negative reaction, we totally understand. Check it out, right? A neighborhood is considered to have concentrated disadvantage when it has highest proportions of female-headed households. The original version of that included highest concentrations of African-American people as well. And I'm sure we all know why those things were included, right? Segregation. All of the issues that come together with female-headed households, right? Not to mention the school-to-prison pipeline, and there's a lot embedded in there. But on the surface, this list is super racist. So what do you do then? And because the data they still thought was relevant and awesome. So what was really interesting, and I was a terrible person because I was like, oh my God, we all need to do concentrated disadvantage. Didn't read the type on what was included. Somebody's like, how do we talk about this? And I'm like, oh my gosh, you're not going to talk about that. And so, okay, so maybe this is a violation, but they hid it. Instead of using those exact words that were from the data analysis, they did the words in the left. because on public assistance and unemployed, those things also smack of people willing to blame individuals as opposed to looking at systems. You see where I'm going with this one? So concentrated disadvantage was like, whoa, here we go, this is perfect, and it's a super big problematic message if I dig down deeper. All right, next one. Okay, so I have been rambling on and on and on about the fact that we need to make it about systems and structures and environments, not individuals. And you're going to go home or, I don't know, turn around in your cubicle and be like, okay, now how am I going to do this? So here is how you're going to do this. And we are going to look at this very, very quickly because I am taking way too much time today. But let's look at number 2 first. So usually when people flounder, so I'm just going to start and tell you how I do this. Let's look at school dropout, for example. When I look at a phrase like that, my mind goes to the action a young person took, right? They dropped out of school. And what I want to do instead is make it so that it's clear that the school, and there's a finger pointing here thing, and I know we'll come back to that the school did something that caused them to leave. That's the flip. Anybody got something? It might not be as handy and easy as school dropout because these reframes never are. But does anybody have a suggestion or a way that you could talk about this issue without making it about kids who choose to drop out of school? Okay, here's Kat. Lack of supportive programs in school, love it. Retention rates, interesting. When the systems fail them, love it. The mismatch between the young person and how the school educates and engages, awesome. Fabulous. This is exactly the kind of stuff that I'm talking about, right? Even something as simple, thank you, Farah, as retention rate puts the onus on the school, not the kid. And that's, excuse me for continuing to use kid today, and that's what I'm looking to do. The language I've seen a lot is pushed out, students who are pushed out of schools, but that's what we're trying to do. Good job. All right, advanced learners, I love it. Can you also see how you're like writing a grant or like, you know, trying to fit 6 words in a paragraph, and you're like, wait. I could say school dropout, or I could say the mismatch between the young person and how the school educates and engages. I'm going to go with school dropout. Thank you, John. Resources not available for students' needs. And look at how John's gets even broader than the school. But you see what I'm saying? There's an economy of space, and that's why we shorthand. Back to my first photograph. Is your goal to have economy of space, or is your goal to change the world? Okay, again, that's a little pushy, but there we go. Back to John's point. If you work in schools or education or school person, you're probably getting a little uncomfortable right now because I'm like, yeah, blame the school. Blame anybody but the young person. Just a reminder, not trying to take responsibility or agency away from young people. Certainly they have it. That said, for reasons, we need to emphasize the external factors and the structures. And back to Geeta, make it about us and what we are doing or not doing. Look at Samantha's, an education system that does not position every student for success in the same way. Right on. She got systems in there too. It goes back to systemic issues, not looking at the teachers that have 45 students in classes, right? And take Kat's thing to the natural conclusion. If we make the conversation about the supports young people get, right, and did an infographic about sitting in classrooms with 45 of their students, no access to healthcare resources, right, no mental health supports, a community that's not mistreated. I'm trying to find a way for like how the system, the structural biases impacts their everyday existence from shopping to driving to whatever, right? Like, is there a way to tell that story? That's what we're looking for here. Are you feeling like I'm wandering way too away from health now? Hewlett Packard, yeah? Okay, so the first one, I'm going to leave that for you to think about, but one of the things that I run into a lot You have more school resource officers than social services people, right? I mean, look at what's going on with those young people in Parkland. Okay, number one, sometimes what I find is all I need to do is flip the sentences around. When I want to say sexual risk behaviors are blah, 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 why don't I put that sentence second and put the one about the structures first? Done. Number two, as you play with these, you're going to find that little flipping challenge is interesting, but the last one is just I'm messing with you to get at some of our shorthands and biases. And number three, just as a little learning point here, if and when you present health disparities data, you must always 100% include a call-out box or caption that includes a discussion about environmental or external factors. Okay, that's not a real rule, that's my rule, but one of the ways to minimize the damage of this data is to include that caption or call-out. Okay, next slide. Oh, okay. All right, so it's going to get a lot harder now because, as you can tell, I have a tendency to move, when I'm talking about disparities, directly into disparities based on race. All of this, no, not all of this, a lot of this applies to any disparity, but I personally believe and see that this is the key driver of what's happening in public health and for young people, so fairly well focused on it. Quickly, Andra, do we have agreed upon strategies to get past at-risk youth other than just saying all youth? I do not, Andra. And if we have time at the end, I would love to come back to this because we've got a really big group, so I'd love to harness the thinking of people. But yeah, I got some more stuff to say, okay? But thank you. All right, next slide, please. So, you know, we talked about individualism. We talked about the fundamental attribution error. And the third thing that I think really makes the case for why we have to take dramatic action is implicit associations or implicit bias. Have you taken this test? Do you know what I'm talking about here? This is a Harvard project, and what they've done is figured out a methodology to see what positive or negative associations people have around different areas or factors. And of course, the one I'm most interested in and the thing that's gotten a lot of play is to do it around race. Really, 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 you may not want to, you need to go do this for yourself. Not just to, and Samantha says she's taken these, right? And it's not just around race, there's like a whole ton of them. Like Samantha, did you take other ones besides the race one? There's something about age, there's something about weapons, there's something about, like, I did one about tanning once. I don't know. I don't know who is, you know, what issues they're trying to get. Oh, the LGBTQ one, right? And if nothing else, to see what this methodology is about, because that whole brain thing is really illuminated by this method. So I recommend. But what they're getting at is, again, a version of the mental shortcuts. Yes, and they've added a ton of different categories. Thank you, Mulda. That, and also people recommend that you do it like every 5 years or something. Do you know what I mean? To see where you are, which I thought was interesting. Okay, so implicit association, shorthand for mental shortcut, elephants in my mind. Next slide. Right? When you're confronted with a word or an image or a picture, what is your first response? AKA mental shortcut. So they have this methodology, you'll go in, they give you the test, they come out with your own score to show you, you can see up here you've completed this African American European. Well, thank you, Samantha. And then my score would have been there. And then check out the percentage of web respondents with each score. So this is old. This is at least like 6 years old. And I'm bringing this up to emphasize and prove mental shortcuts, and also bringing this up as a way to challenge or to quantify, right, that the reaction to communities of color and health issues is not the same as it is with white people. And this data is a dagger in the heart, and we can never, ever, ever forget that the audiences reading our stuff are going to have this exact same response. Are you seeing why I'm so freaked out about continuing to put those health disparities charts into the universe? Next slide, please. If folks don't see the difference between those two park benches, are they seeing the difference between the lived experiences of these two young people? And yeah, I'm making this about race, but there's certainly a gender experience here as well. Did people see the girl that got sent home for dress code violation? Oh, just yesterday? I mean, and how many times do we see those stories? So again, I don't want to get in my gender soapbox, but there we go. The lived experiences of these young people is very different, and it has nothing to do with their behaviors. Next slide. So there's a bunch of research that's trying to unpack why this is. And what they've found is that Americans in particular believe that racism is over. And that racism is really about a few bad people. Because there are some bad people, you know? But there's just a few of those bad people. And maybe stuff recently is changing that a little bit. But I'm going to come back to that, Kathleen. Racism is over. It's post-racial America. We had a president who was African-American. It's over. Missing from this equation is the thing we've talked about on almost every single slide, which is if we continue to think that racism is about just a few people, we are missing the larger systemic and structural pieces of it. And that's, again, what we need to illuminate. Kathleen, I'm sorry, that was an aside that I shouldn't have even introduced, but it just bugged me so much last night that the experiences of women in this culture and body policing, right? The dress codes are applied inequitably to women with large breasts versus small breasts. Oh, I just get crazy about that stuff every time. Okay, moving on. Next one. A moment of silence while you take this chart in. We may think that we get it. I thought I got it. I thought that was a great photo. And by we, I got to say white people. You know, y'all, I just got to say it. And it's not exclusive, but I have the privilege not to get it. I have the privilege to walk around thinking, Democrats, we're all on board. No, we're not. So there we go. I'm moving on. And I'm hoping that all of us are having the reaction that I'm seeing from Kat and Samantha, right? And this is old, and maybe it's changed. Then maybe it hasn't. Next slide. So the community of public health and foundations really were really concerned is the best way I can, and this is my story now, and so take it with a grain of salt and go read this report to get your own perspective on it. And one of the beliefs that was floating around, this was like 5 years ago and it started to be visible to me anyway, was that, you know, we haven't made much impact on these disparities, right? And the infant mortality rate, rates down, disparity up. So what is going on? And it's sort of a smack upside the head that, oh, yep, got to do those social determinants now, and look at what's embedded in that, right? Structural bias and institutional racism. So how do we do this? How do we talk about this? And that's when we got this publication from the Robert Wood Johnson Foundation. They hired a very famous framing guru and did this research, and this thing will tell you all about the methods. This is one of the few framing research pieces that I've seen that's really specifically calling out, like, how do you move this forward with different political perspectives? Usually they don't make it that clear, but that's part of the agenda. And, you know, who doesn't agree? Social determinants of health, that is a clunky old phrase. We got to do something else about that. That's why you see me flipping around with externals or environment or whatever, right? And so their goal is to find new ways and new language to talk about it. And what you're going to see when you go in there is that based on the understanding of how white people see, don't see racism, see, don't see external factors, et cetera, that these words and phrases are not effective and don't use them. Letting that one sink in a little bit, right? Racism is over. Post-racial America, no such thing as white privilege. The land of opportunity, historical experience, that was so long ago. What are you talking about? This is America. Everyone is equal. The justice system is just. I don't know what you're talking about. And my grandpa came over on a boat and made his way and made all the money, blah, blah, blah. But when you use these words, you're triggering instantly the resistance of, what? No, not true. Next slide. And I understand why they're making that recommendation, right? I mean, how many people are tapped into this like, oh, no, it's identity politics, and we need the big umbrella, we got to have room for everybody, but can't make it just about those women's rights, can't make it just about Black Lives Matter, blah, blah, blah. And I see where that goes, and it makes sense from the framing research perspective too, right? Like, what they talk about all the time is that if you can define the group, the us group, as big as you can, right, so that nobody's on the outside of it, you are promoting a collective interconnection and shared values and all that sort of stuff that is super compelling. And so if I make it about women, oh my gosh, I've excluded men, that's not so good, I got to make room for them, blah, 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 right? I totally get why they're doing it. And making people us is, boy, my full-time job. But is this problematic? And yes, the answer is yes, it's problematic to not say those words. Next slide. They went so far as to test messages, right? We had another session that was all about leading with values. And the American value around fairness was a compelling lead value when you were talking about disparities, as long as you made it about place and not about race or ethnicity. Again, I know you're getting nauseous because this is just reinforcing the stuff we've been talking about, but there it is. They walked away saying, you know what, if we can make this whole thing about places, we have a winner. Next slide. This is the language they tested, and this is what was effective. Certain communities are struggling because they aren't given a fair chance to get in good shape. They got the fairness in there. And look at how the individual stuff is still embedded in there. Interesting, huh? Next slide. Yeah, one more time. One more time. Oops, okay, sorry, backwards. Sorry. Here's another piece of language. And this, has anybody seen this before? Right? It's everywhere, everywhere, everywhere. And I love it when people adapt it, right? It's our mission statement, right on, where we live, learn, work, and play. And Samantha, did you know that this is where it came from? Fascinating, fascinating. Yeah, so yeah, Samantha's going to really want to read this report. Yeah. And I have no problems with this. I have no problems with this sentence, right? It totally gets at social determinants. Totally an awesome lead for every single message that I've been asking you to talk about today. Okay, next slide. So, given everything I've said, you can see why I was very excited and receptive when I heard one of my fellow University of Minnesota folks, a doctor researcher, talk about the fact that race is an artificial construct and we need to start thinking about how to replace race on the axis of these charts. About fell off my chair. A lot of pushback on my friend who did this presentation, but this is what I've been starting to think about a lot ever since I saw her talk. Again, I know we need this data. I totally know, right? Like, if we didn't have this data, we wouldn't be able to dedicate resources to certain communities. We wouldn't be able to engage them effectively around their own things that they want to work on. I totally know that. But is this the only chart? And is this the chart that's going to move us forward in big public audiences? And my answer there is no. Next chart, please. The next slide. So this is who I saw. Wait, is her name on here? Here she is, Brooke Cunningham, MD. Oh my gosh, ask her to do a webinar for you. Her stuff is really more data researchy, so there's a lot of stuff that I couldn't really understand and stuff. But she was the one that illuminated these ideas and these constructs and put me on this path of hers around replacing race on the axis. This might have been recorded, I'm not entirely sure. Next slide. If you're freaking out right now, here's what I'm talking about. Oh, can you do me one more? Instead of having race on that bottom axis, what I would love to see is if we could show teen birth rates against housing, right? So like the bar charts would be young people who have access to affordable housing versus non, or young people who young people who have moved 3+ times in the last 2 years versus none, right? Or school quality would be another one, right? Like, could we have teen birth rates or teen pregnancy rates against school quality, like percentage of SROs versus mental health practitioners and counselors, or right? Teen pregnancy in schools with robust after-school programs that are sports and beyond versus not. Could we have it, right? Schools that have proximity to a clinic and or have a school-based health center or not. You see where I'm going? This is the thing that I dream about. Anybody got that? Can you see why I get really excited about like some of those infographics that we saw before? I'm running out of time, but I would love to hear ideas on how we could get to this, right? Generational daughter of teen mom. Oh, I'm kind of wondering where you're going, Farah, but yeah, like what else illuminates teen pregnancy or a specific adolescent health issue in terms of social determinants, and how could we capture data that shows that impact to support our efforts to do these things? Because I know that you're all thinking I do, age of father partner, interesting. Generational poverty, right? Family religious background, again, so cool, right? And what a different way we would be looking at things if we were that way, right? Like even Kat's suggestion, like what if we started to center, and I'm not a particularly religious person, but to center analysis around strength of community that might include religion or faith as part of that. Wouldn't that be interesting? So at any rate, thank you for indulging here. All right, I just forgot my thread. So let's move to the next slide, because believe it or not, there's still more. All right, so you've seen what's come out of this report is that make the whole message around place, construct it around places, not race, and have that be the lead. And here's more language that they used. Loving number one. Number three, a little bit triggering eugenics, a little bit, but that zip code makes for really good visuals. I've seen Alameda and a bunch of places use this really effectively. Next one. So this is just a litany of examples, right? Loving what they're doing here, where we overlay income with life expectancy. You've seen that before, and you can GIS that. These data sources are clear and easily get it at. Good language, Glennis. Could you go from here to a discussion about youth, I don't know, violence? I don't know, what? Next one. Here's one of those indexes that I talk about. I was so excited when I saw this on a poster at AmChip a couple of years back. Health opportunity indexes. I just love the name of that, right? It totally aligns with the framing. And you can see the indicators down there. I'm going to let you guys look at those yourself. But look like population churning indicator, local commute of workers, racial diversity, right? Interesting how they went with racial diversity as an indicator versus, you know, percentage of certain race. And again, I don't have time to really dig into how our default ways of checking these data points are structurally racist as well, but another time. So, so again, smart people who know this stuff, you dig into this one because I thought this was super cool, and wondered about how we could apply it more to adolescent health. Next one. So this was my rudimentary attempt to get at it. And behind my thinking, this is from that chlamydia report. In Minnesota, we have really high rates of sexual health challenges, rural as well as urban. But what do you suppose Minnesotans' reaction to when they're faced with this data, right? First off, we present just rate data, which is problematic in terms of population data when you're comparing white populations to communities of color. But second, the suspicion is that it's all an urban thing. So this was attempting to get at that. The other thing that happens when you do these maps is you have people finding themselves on the map. And that whole process for me is part of that usness, A, and B, relevance. Oh, where do I fit here? I am part of this, and I want to know where my stuff is, and then I'm going to compare it to other people. I love the way that process works. Okay, quick look. You can also look at reproductive health. I'm looking at Samantha's note. Outcomes by the level that the policy interferes with access. Ooh, juicy. Especially abortion. Right on, right on. Wouldn't that be a cool report? I'd pay good money to that. Access to public transportation to actually get to the clinics, right? And you can see that on the map too, Pat. You could see transportation lines next to clinics, next to school locations. Heck, isn't there something like Snapchat could do to help us out there? Anyway, moving on. Next slide, please. Here's another rudimentary attempt. Back in the day, we were like, okay, what social determinants data could we put up there? So we have birth rates and chlamydia rates next to living in poverty and AYP dropout rate. I know, bad language, I know. But still, you see what we're trying to do here is to show, even though we couldn't do overlays because print, ridiculous, but to show that, oh, look at how that works, huh? Interesting. These are all overlapping. Interesting. That was the intention. Next one. Turns out, like, and again, somebody smarter, jump in. Hospitals, because of the Affordable Care Act, have to do some level of community surveys to understand what the social determinants are that are impacting their local neighborhoods. And so they're doing a level of this data collection around places. And you'll look at this one, grocery stores. So, and what freaked me out was that all these commercial vendors are like giving them GIS, you know, apps. But this existed. This is something that Rena found when we were looking for a lot of the environmental data. Here's from Ty Bryant, access to the clinic and youth-friendly providers. Okay, and so you bring up something really important to me as well, right? And I had this brain flip the other day that was like, how much time do we spend interrogating young people versus how much time we spend interrogating the doctors, coaches, teachers, youth workers that work with them? Right? I mean, I don't know that, and again, as a white person, I'm not trying to excuse this, but like having not had that experience, maybe having had it as a fat person, but like just the daily activity of interacting with people who are making those assumptions and biases, we know from the research that that's having corrosive effects. So why aren't we examining the role that those people, the adults, are playing in that? Okay, anyway, soapbox, next slide. I'm running out of time. This is again from Louisiana, and they were using that concentrated disadvantage, which, as you know, was super problematic. You can imagine they put this slide up and the entire audience just freaked out on them because of the female-headed household part here. But this is what they're trying to show. Let's look at the difference between Layla and Emma. Bam, on the map. And it's separated by 6 blocks, right? I don't know this neighborhood so well, but it does look very close. Why is that? That is weird. Next slide. Yeah, I love technology, GIS, awesome. Don't know what to do with it, don't know how to do it. Haven't had any opportunities to work with those folks, would like to. But second, if place-based messages are the way to go, what are we doing that's like super place-based, right? Like, are we poised to tell these place-based stories? You know how like the Harlem Children's Zone, or I know there's another one around birth outcomes, and the Carrera model, right? It's all around, local community building, block by block sort of stuff. Are we lined up with that? Should we be? Right? Is this a different way to think about our funding efforts or putting priority populations together? I don't know. Haven't thought through this one, but I do think that we need to consider how we align if this is the way we want to go. Next slide. So I'm stepping away from the Robert Wood Johnson recommendations and saying, in addition to illuminating the environmental or structural disparities in places, also need to be really direct about illuminating structural racism, or you could say structural bias or systemic bias, whatever word you want to put there. But these implicit associations as they pertain to race or age or gender must be called out and illuminated. Next slide. Close to home. Close to home. And yet, what has our public health community here done to address this fact that young people are living with this experience daily, and we're just recording teen pregnancy data? And again, I'm sorry to be cynical about this, but we held a Konopka Institute lecture across the street from where this shooting happened, right? And was it something that was going to come up unless we forced it? And what was the nature or the color of our audience that day, right? You need to cast the eye on myself to know, what am I doing? What are we as a public health community doing to address this? Next slide. If we make it about place and never get to racial bias, we're continuing to erase or minimize the issue and the experience of these young people. This is the coolest app ever. You can see how this hashtag grew across the world. It's an amazing thing. Geotag tweet apps. Next slide. So I am, as I said, I walk away from this. Can we do one more click? I think I have something else in here. Oops, back one. I had read the Robert Wood Johnson work. I had run around saying, okay, make it about place. It's all about place. It's all about place. That's great. And then I had a training from the Applied Research Center folks. They are a group affiliated with Color Lines. If you don't read the Color Lines blog, go read it now. It's an excellent news source. And they were very frank. No, you can't not talk about it. You have to make it visible. And let's figure out how. Next slide. Skip this. We'll come back to it if I can. Sorry. First off, measure it. Here's the Burfus data. More. We need more of this information. Next slide. Okay, so here's where I was trying to go. I will believe that leading with racism or structural racism is problematic, particularly for white audiences. But what I've come to understand, and this is mostly from people that have been in trainings with me, is that you can get to structural racism by starting with place. So if you narrow in on a specific area or community or place, right? And talk about how life expectancy or teen pregnancy or whatever rates are really super concentrated in this one area, then that gives you room to say, and check it out. This happens to be the most highly segregated community in Minneapolis. Check it out. Land use policy allows the dumping of garbage here. Check it out. We built the garbage, the burning thing. Sorry, I'm losing languages. We burnt the garbage burning thing, and look at all the asthma rates here, right? So that's how I've reconciled this with the help of a lot of friends. And the headline from the Atlantic City, Place Not Race May Better Explain America's Health Disparities, really captures that well. Remove one more slide for me because I think their text is here, right? We should be asking what's going on in these communities, not what's going on in minority populations. And this, for me, reflects another thing that I didn't realize. For me, I interpreted race on the axes of those charts as the experience of oppression for community, and that is not the way the rest of the world is reading those. Okay, time out while I look at these things. If we move from race-based to place-based data collection, how do we deal with the erasing of Black? Totally 100% agree, Kathleen. And that's why I feel like if I was going super meta with my recommendation, I would be like, yeah, start with place, and then the very next thing needs to be the impact or the negative outcomes for people of color in that area. Does that make sense? So I would still put it in there. I just wouldn't have it be the first thing that happens. That said, I still feel like there's a struggle around that. It still feels a little icky to me, but yeah. The other thing that Kathleen's getting at here that I think is really important is what are goals, right? I am all about this change public will, move public perceptions, but there's a large part of your work, I know, where you're walking into community with data to help inform their own work. So I'm not suggesting that you hide race in those instances. Certainly you still want to talk about environmental factors, but you see what I'm saying here? So I feel like it's two kind of different goals. And I totally still think that tension of erasing Blackness versus promoting racist attitudes among white people is right there. I don't know what to do. Here's Farrah. Why can't we also talk about positives of different races and cultures, right? Like, why isn't there, how is that reflected in our assessment of young people and their behaviors? Aren't most of those mental health and outcome and well-being measures driven by a largely white research community who may entirely misinterpret what that means in different cultures? Totally right on. Very excellent point. Here's Samantha. I think the idea that we in public health use race-based data to inform our programs when we talk to the public health. Thank you. Thank you, Samantha. Excellent. Excellent. Okay. Getting close to the end here, and I really appreciate the comments in the chat box. Thank you. One more slide. Okay. So racial redlining. I don't know if we can do this, but how many people know what racial redlining is and the racial redlining story? That is the question that I ask when I'm training, and I used to see like maybe a quarter of people's hands. Nowadays I'm seeing half of people's hands, and this for me is an indictment of our education system in the public health community, that these things are not brought up and discussed. But the story, as quickly as I can tell it, please go see the PBS video or read about this yourself, is that back in the day, especially when they were getting ready to dump a lot of money and land on soldiers returning from the war, city planners, aka government and systems, collaborated with financiers and housing builders to draw lines of where people were going to live, and by that I mean what color of people were going to live where. And they intentionally drew lines in neighborhoods they felt were plush or desirable. They made the plot sizes, they made the sizes bigger, and then they made it impossible for you to live in a neighborhood if you did not conform to their expectation of your race. You could not buy a house in a white designated community legally if you were a person of color. And I'm sure you can imagine where it goes from there. Next slide, please. The map is of Richmond. This content is from Minnesota. And again, how many Minnesota public health professionals working in the Twin Cities know that North Minneapolis, which is our most highly concentrated community of color, was created that way intentionally? Next slide. Do me a little more. Next slide. One more. I don't like that one. One more. All right, you've seen that. This one. This is good. Oh, nope. Go back one. I'm so sorry, Rena. Animation. Okay, click. Okay, this one. Yeah. When I was doing this committee report, that's the one. Perfect. I had to do a page on health disparities, right? Because the committee rates much highest among African-American communities. And I'm like, okay, where do I find something that really is like totally evidence of structural racism? Was unable to find anything in the health field. Did find it with finance and banking. And so this is what I included, and it's like, it's almost like a pop quiz. So what does lending bias have to do with chlamydia? I know you know the connection here, but it was both an ecological factor and literally the only thing I could find that I felt was really shattering to Minnesotans' sense of, wait, what? Okay, next slide. Okay, Alameda County is the rock star in this area. If you want to do this and do this well, go look at their stuff. Everything from place-based to direct call-outs of ecological factors to directly getting into racial bias within themselves and within the society at large. They are my total gold star. All right, 1 minute, one more slide. One more. Oh, nope, back one. Okay, that's the one. So, I don't know if you realized it, but we just spent an hour and a half pretty much talking about how to make discussing racial disparities in the impact of structural racism palatable for white people. And that's my job, but it doesn't mean that that's the right job or the only job. And I don't really know what to do with this next. What I ask us to do is to reflect on the nature of these changes and how that impacts what we're doing day to day. And what that means for who is at the table and whose voices are heard and how we go about making these changes, right? Like, I'm sitting here thinking about all the different things that could go on that axis to replace race, but what do I know? I'm not from that community, so who should be the one telling those stories? That's the question. Next slide. And how do we get there? The other thing that I think about, and I know I'm a minute over, is the communities really are already telling us what needs to happen. And why am I not including these things on my list? Right? Like when we talk about health and educational outcomes, the impact of the charter schools, that never comes up. Why? When clearly a community believes that that is central. Next slide. So these are the questions that I leave with and that I leave you with. Thank you, Shelley Diggett, and thank you for adding the Alameda connections here.